So we are New Englanders, right? We aren't dummies when it comes to dealing with cold weather. We know how to do this, but these are really important tips because the temperatures that we're dealing with today are no joke. So how long does it take in these frigid temperatures for it to really become dangerous for someone?
Well, that all depends on age and what you're wearing. So obviously anybody at the extremes of age, babies and those older adults, 65 and older roughly, have much more difficulty with regulation of heat. Babies, because of their small stature, are going to release heat faster. And people on the older end of the spectrum have less muscle mass, so they generate less heat in their body. So it depends on what you're wearing, and it can be a matter of minutes to a matter of hours and depends on activity. So it's a very broad question. What we usually recommend, especially for clothing, is having a nice base layer that's not cotton. Cotton absorbs your perspiration, so you want to wear something that's wool, silk, or polypropylene. On top of that, a thermal layer of fleece that'll retain your body heat, and then a top coat that will repel water, repel some of the snow, and that's really your best bet. And obviously mittens for your hands and good wool socks and a good pair of boots.
All right, good tips there. What are the signs of hypothermia that you should look out for?
Sure. The first stages we're all very familiar with living in the Northeast, and that would be considered a little bit of frostnip. That's when the nose gets cold, your ears get really cold, maybe in your gloves because your hands are sweating. You'll notice that the hands are very cold, and they can also become numb in those areas too. Frostbite is when we start to have tissue damage, and there's 3 grades of tissue damage with frostbite. And that has to deal with when the fingers get very numb, waxy, and hard in appearance. The next stage, you'll start to notice some blistering of the skin, very similar to a thermal burn, like a scald burn with hot water. And that's when it gets dangerous and you should seek medical treatment.
All right, so what should you do if someone you're with is starting to show these signs? Is there something that you can immediately help with?
Sure. I mean, looking for signs of hypothermia would also, obviously you're going to be shivering in the early stages. You're going to get a little chill now and then because it's cold outside. That's fine. But again, based on activity level, if you start to really shiver for a prolonged period of time, 5-10 minutes even, now you're getting into first stage of hypothermia. Then you should have a partner if you're going to be hiking or doing any snowshoeing or skiing outside, and make sure you're talking to your partner. If they start to become confused, combative, disoriented to their surroundings, now we're starting to have some mental status changes associated with that hypothermia, and that gets a lot more serious.
Yeah, we all have to take care of each other, check in on your neighbor, bring your pets inside,
Right.
So important. Dr. Mazo, thank you so much for your expertise, and we appreciate
You're
you coming
welcome.
on the Fox 61 News at 4.
Thank you.
All right, so living in southern New England, as we just discussed, you never know what to expect with the weather, especially during the winter. And we've had some frigid Februaries, I'm sure we can remember, and some mild Marches. So dressing for the season